Wow, so you actually inspired by how you saw other consultants working
and
what you saw in their work. What's kind of most exciting you about advances in the treatment of diabetes?
So I think if you look across the board, I would say type 1 diabetes has got to be...
Well, the challenge is that less than 5% of people with cancer are treated on a cancer clinical trial. While at the same time, there are hundreds of cancer clinical trials that are running behind because they can't find patients.
Well, to be honest, it's the toughest time I've worked in general practice in the last 15 years.
Well, how can we solve for these problems so that we can have mass manufacture in a space environment?
So it's startling when government are asked about the incidence of diseases, how inaccurate their own figures are.
Education is an experience, and that's the key thing. It's
2010, estimated time of doubling of medical knowledge about 3 years. Guess what it's now, Daniel?
Well, it must be less than
that. Yeah. Estimated time for doubling of all medical knowledge.
Oh my goodness, that's ridiculous.
You get left behind if you don't know it, and I need to know.
A dirty little secret.
And we're building a pharmaceuticals factory in microgravity.
We are finding that politicians are more and more interested in colorectal disease. One of the big issues is
the impact that this can have on everyone is just gigantic.
Hi, I'm Daniel Ghinn, and this is Better Listening for Better Health. It's a podcast about how healthcare professionals learn and share medical knowledge. We're going to discover this together by listening to some of the most inspiring doctors, nurses, and scientists that I've met. We'll hear them talk about how social media impacts their work and helps them to achieve better health. Our first episode is coming very soon, so please follow or subscribe on your favourite podcast platform so you don't miss it. I'll see you there. All right.
Thanks, man. Thanks. Good job.